Allopathic medication, part 16. So there are five different domains, and we'll discuss all of them one by one. Domain 1, risk of bias, a judgment made on the basis of the chance that the bias in included studies has influenced the estimate of effect. Domain 2, imprecision, a judgment made on the basis of the chance that the observed estimate of the effect could change completely. Domain 3, indirectness, a judgment made on the basis of the differences in characteristics of how the study was conducted and how the results were actually going to be applied. Domain 4, inconsistency, a judgment made on the basis of the variability of results across included studies. Domain 5, publication bias, a judgment made on the basis of the question whether all the research evidence has been taken into account. In case of observational studies per grade, the quality of the evidence that starts off lower and may be upgraded in three domains in addition to be subject to downgrading. Well, the large effects, number one, large effect. Methodologically, strong studies show that the observed effect is so large that the probability of it changing completely is less likely. Plausible confounding would change the effect despite the presence of a possible confounding factor that is expected to reduce the observed effect. The effect estimate still shows significant effect. Number three, dose response gradient. The intervention used becomes more effective with the increasing dose. This suggests that a further increase will likely bring about more effect. Meaning of the levels of quality of evidence as per grade. Next, high quality evidence. The authors are very confident that the presented estimate lies very close to the true value. In other words, the probability is very low that the further research will completely change the presented conclusions. Next, moderate quality evidence. The authors are confident that the presented estimate lies close to the truth value, but it is also possible that it may be substantially different. In other words, further research may completely change the conclusions. Next, low quality evidence. The authors are not confident in the effect estimate, and the true value may be substantially different. In other words, further research is likely to change the presented conclusions completely. Next, very low quality evidence. The authors do not have any confidence in the estimate, and it is likely that the true value is substantially different from it. In other words, new research will probably change the presented conclusions completely. Categories of recommendations. In guidelines and other publications, recommendation for a clinical service is classified by the balance of risk versus benefit and the level of evidence on which this information is based. The US Preventive Service Task Force uses the following system. Level A. Good scientific evidence suggests that the benefits of the clinical service substantially outweigh the potential risks. Clinicians should discuss the service with eligible patients. Level B. At least fair scientific evidence suggests that the benefits of the clinical service outweighs the potential risk. Clinicians should discuss the service with eligible patients.